Good morning and welcome, everyone. Today, as everybody's joining us, we're going to be focusing the session on the impact of the pandemic on child's development. We're going to be looking across a little bit of an age span there. And before we get going, we're going to let Armando, our interpreter, go ahead and provide some instructions right now. Armando.
Buenos días y bienvenidos a todos a esta cumbre que tenemos hoy, esta presentación. Si necesitan servicios de interpretación, vayan abajo de la pantalla y escojan hay un globo, un símbolo de un globo, y por medio de ahí pueden escoger el idioma que será el español para escuchar esta presentación en español, y lo puede hacer también de su teléfono celular. Así que ahí puede entrar y escuchar esta presentación en español. Muchas gracias.
Thank you, Armando. And I know you're all experts on this by now, but please use the chat for comments, resources you might want to share, encouragement, and also use the question and answer feature as well, so we can go and have all of the questions right in one place for our wonderful panel of presenters. As some of you met me yesterday, I'm Patty Moore. I'm with Alpha Resource Center of Santa Barbara, and I am, our agency is a council member agency with Family Voices. We've been a part of Family Voices since the early years. And today, with a focus on the impact of the pandemic on child's development, we have esteemed panelists. Excuse me, just one moment. Armando? Okay, we don't hear it anymore.
Oh, okay.
Okay. And there's, excuse me, there is the interpretation feature on the bottom of the slide. Okay. Technology, my favorite. Thank you. Again, three wonderful panelists. I'm proud to say they're all parents, and they're all very active advocates for children and youth. We're going to go ahead and start this with a little bit of looking at the youth side, the young adults, and the impact of the pandemic. With that, we're going to be hearing from Felisa Strickland, a parent advocate, full-time single-parent caregiver of her 22-year-old daughter, the beautiful Lily, who I happen to know personally. And she's going to be sharing her journey over the last few years as well, with also some words about moving forward as well with a different lens. Felisa, thank you for being here. And I'm just going to go ahead and let you share your screen now.
Okay, let's see. Bear with me.
We're all patient. There we go.
Yep, and it'll be up in just 1 second.
Yeah, it's coming on there.
Great. Well, while it's waiting, I'm just really excited to be here and share my story. I love any opportunity to do that. Lily and I, yeah, she's here with me. So I've got my remote to try to control the music. She loves music, so don't be surprised if you hear a little bit pop in. But anyway, this is our story about our family during the pandemic and beyond. This picture over here on the left is Lily and I at our first advocacy trip to Sacramento. I'm Felisa. I'm a caregiver. I'm a teacher, a nurse, a chef, a housekeeper, a bookkeeper, a banker, a therapist, and a transportation service. The list goes on and on. I wear so many hats and have skills I didn't even know I could learn. I'm a fierce advocate for people with disabilities and special healthcare needs. And like many mothers who came before me, I wear many hats in one day and have a unique and diverse career path shift that was prompted by my most important and rewarding role. I am a mother. I am Lily's mother. That was the beginning. We're somewhere in the middle, taking one day at a time. The two of us together are navigating this life where the terrain is often uneven, very bumpy, and not at all made for us. This is Lily, my daughter. She is a bright guiding light. She is smart, funny, loving, and kind. She is a good friend. She loves all kinds of music and being with her family and friends. She enjoys nature, seals, being on the water, be it by surfboard or kayak, and has been known to get a sprint going at the Special Olympics school games. She also enjoys looking at pictures and watching YouTube on her iPad. Her iPad is her voice, and it also comforts her in this sometimes uncomfortable world. She needs full support with all of her daily living activities, including personal care, health management, and decision-making. Lily is diagnosed with cerebral palsy, autism, intellectual disability, and epilepsy. Before the pandemic, our routine was pretty set. It's been just the two of us since we lost Lily's father to melanoma in 2010. We are very close. We're used to spending a lot of time together. I'm Lily's full-time caregiver. In the fall of 2019, that was Lily's first year of transition class. While she was at school, I would usually take care of the house, grocery shop, do laundry, take care of various trainings, go to parent support groups, walk, and do other forms of self-care. It has always been a challenge for us to find respite workers, so I really made sure to do everything I could while I had time away from Lily, as to not to disrupt her care. She was loving transition class. She was ready for the shorter day, the being off campus and volunteering and exploring new interests. She was growing into herself. She was energized. When she would get home in the afternoon, she would usually have either ABA therapy or OT at the medical therapy unit. We would take walks at the harbor on the weekends, go out to eat, and visit with friends and family. We even went to Kauai for her 19th birthday. She was happy. We were happy. Our life wasn't perfect. We faced the usual challenges that our families navigate, but we were slowly moving toward next steps into adulthood with a few years of transition ahead and felt like we were on the right path. Then March 13th, 2020 happened, when that was supposed to be a couple of weeks of shutdown turned into 18 months of home quarantine from COVID-19. The world, our world, forever changed. Here's some pictures of that fall, and you can see Lily in the middle there. That's her first day of transition class. She's out with friends over at Alpha on the left, and her best friend Debbie in the middle there, working at the uni shop at the bottom. Here's a couple of pictures from our trip to Hawaii, our Best Day Foundation in Santa Barbara, and then also one of our ABA sessions where we're making pizza together. You can see she's a pretty happy child, or young adult, I should say. During the pandemic, at first, it seemed like an extended spring break, just as they described it. But it didn't take long to realize that something big was happening. We were presented with distance learning via an online platform called Zoom, now used regularly everywhere. One one-hour session was supposed to take the place of 35 hours a week of community outings, lunch with friends, bus rides, a routine and loved life with people that offered friendship and support. Needless to say, it didn't work. And while we were grateful to see those faces each week for that hour, it wasn't enough. Suddenly, depression like I had never witnessed took over our home. Lily stopped eating, only wanted to lay in bed. She would get so anxious when I would suggest any activity outside of her iPad. Lily uses her iPad to communicate. I couldn't take it from her, but I would try to distract her sometimes by suggesting a walk. She would just scream and protest. She used to love to walk. Her therapy services stopped. She lost her communication and dressing skills. She also began to have increased seizures. Eventually, we did our best to work with doctors and therapists via telehealth to resolve some of these issues, adding new medications, new foods, establishing a semi-routine. But in the end, anxiety and depression won. My mom heartbroken to see her go through this. We were both going through it. My mental health suffered too. I was used to wearing all the hats, but not 24 hours a day, 7 days a week with no break in sight. I was grateful to be able to access online therapy. It helped. Also grateful for online support in our parent-to-parent group through Alpha. Lily and I are both high risk, so we did not have other support coming into our home. Zero. It was just me and her. It was going to be a long, long pandemic with severe impact on us both. It was only the beginning. Something had to change. So we created a new vision together. We took one day at a time, stayed hopeful and connected. And these are some pictures of some actual vision boards that we created together to give ourselves something to do, but also something to look forward to. As the pandemic continued, we were doing things differently now. The 2021 school year, we were offered 2 30-minute Zoom sessions per week. Not acceptable. I expressed that I expected daily instruction with reasonable breaks and para support, and that's what we got. We had school for 3 hours a day total. We had a 2-hour break in the middle where I would get Lily to eat lunch and we would go for a short walk. We did cooking as a group on Tuesdays and art on Thursdays, and on Fridays, the class went on a virtual field trip. We traveled all over the world and the United States, and Lily and I dressed for the occasion every week. We were making the best of it. We still had plenty of hard moments every day, but these activities gave us something to plan for and look forward to each week. It didn't work out all of the time, but it was better than 2 30-minute sessions a week. Many times Lily would need to wear her headphones and wouldn't even look at the screen, but with my support and accommodations, we could participate, and we both needed that, so we did it. Many families could not do that for a variety of reasons, and my heart breaks when I think of the strain of their situations. Even with all of our hope and vision, our situation was and continues to be very trying. We made some progress with eating, walking, and joy once we established more of a regular routine, but we have never fully bounced back from all that this pandemic brought along with it. I contracted COVID in December 31st of 2020 and was too sick to care for Lily. She had to quarantine with a friend for 2 weeks. It took me a month to recover, and I still suffer with long COVID symptoms. This pandemic might be ending, but its effects live on, and there is no back to normal. We are changed forever. Whoops, I'm sorry. There we go. Nope. How do we get back? I'm so sorry. Let me try this. There we go.
No worries there.
Here we go. Pandemic distance learning. These are some pictures from that. And as you can see, we tried to make it fun. We had cooking and art and traveled. And we did have fun. And there in the middle is Lily very enthusiastically going for a walk. So things did get better once we figured out a plan. A pandemic hospital stay is as bad as it sounds, especially if you're a caregiver to your adult disabled child. I had never experienced such disregard and felt so insignificant before, and nothing could have been further from the truth. Lily had surgery in March of 2021, and she was unable to recover at home due to pain, so we ended up in the ER and admitted for 15 days. Like I mentioned in the beginning, Lily needs support for all of her daily living, so obviously I needed to stay with her. This is a real issue that apparently there was no thought out solution. Lily needs someone with her at all times. That's not covered in a hospital stay. They considered me a guest, and those weren't allowed, but considering Lily's care needs, they knew I needed to stay. There were restrictions on all things guests, so no food for guests, masks at all times, and even when it was just us, but not for her, only for me. And they weren't kind about it. I worked it out, but not without a fight. It was a horrible experience, and I wouldn't wish it on anyone. We were there for 15 days because Lily couldn't eat or take her medication, and we couldn't leave until she did. I was already in distress from her condition. The treatment from the hospital staff definitely didn't help, but we pulled through and eventually went home. A year later, we had to go in for a scheduled EEG overnight, and that ended up being 7 days. While there were still quite a few restrictions, I was able to express concerns and ahead of time make arrangements so we didn't experience the same thing. The COVID protocols are needed, but so are accommodations and considerations for families with special healthcare needs and people who need round-the-clock care for safety and beyond. Here are some pictures of our hospital stay, and as you can see, we weren't having very much fun, and Lily was definitely not feeling well. At the end, she finally smiled when it was time to go home. As the world reopens in summer of 2021, Lily is able to return to in-person summer school. She's excited to ride the bus and see her friends and to have some place to go, not to mention get a break from her mama. We are nervous for the reconnection to the outside world, but hopeful that we will be okay, especially since we were both able to get our first vaccine doses earlier in May. Day by day, things were getting a little bit better, but her usual zest was less frequent and her anxiety remained. The next school year, there was no transportation services, so I drove her. It worked, but it wasn't the routine. She was less excited about school, having to wear masks, no community outings. It wasn't the same. Things were better, but still not good. There were some days, good days, but lots of hard days with anxiety, screaming, and calls to pick her up. Things that in all of her life I had never experienced. Lily has always loved school. But again, we made it through. And in July 2022, I got COVID again, and Lily got it for the first time. Thankfully, since we both had been vaxxed and boosted, we didn't suffer the way I did the first time. The fall of 2022 was Lily's last semester with the school district. Most everything seemed back to normal by now, but honestly, it was never the same. I wish I could say she enjoyed her last months, but I don't think she did. Again, we made the best of it, got through it, and who knew it would be preparing us all along for where we would be today. Here's some pictures of the last semester of her school year. And this picture here of her AAC device, I hear this a lot now. I feel sick and tired. She does look better, but not as good as she did in 2019. So you can see that this pandemic has definitely taken a toll on her and me. Transition into the great unknown. That's where we are now. Back to COVID times without the virus. No place to go, no routine, no friends to meet. All the things we did to help us get through COVID the first go round aren't working this time though. The anxiety is high. Some days it keeps us quite isolated. We won't give up. We will keep trying to come up with our own solutions, but revealed is a very broken system for both children and adults. And right now the adult side of things is in crisis, adding to already challenging health conditions for many. As a full-time caregiver, I can say that this job is extremely necessary, yet it does not get the recognition and respect that it deserves. We need people to want to be caregivers, paraeducators, and just direct service providers. Every area of the disabled community is suffering due to lack of providers, making it impossible to grow programs that support the hundreds of adults coming out of the school districts each year. We have to do better at making these positions attractive and sustainable to the big-hearted individuals that we need to fill them. They need living wages, benefits, and support. Parents aren't going to live forever, and many are suffering with their own health issues, myself included. We must advocate now for funding and supports. Reach out to your legislators now to express your concerns. We collectively will do what we always do and press on, but we need to shine a light on this issue now. It can't wait. Care can't wait. Lily and I are exploring options through self-determination to try and create a plan for her day, but it won't be easy. It is taking a long time, and we have a ways to go to get there. I can only hope that once we do, it will be what she needs and wants. One thing is for sure, we will never give up. Together we can and will make a difference. Keep telling your story. Thank you for listening to ours. Let's stay hopeful and connected. Thank you, everyone.
Thank you so much, Felisa. I think Patty might have fallen off of our Zoom for a second. I'm gonna go ahead and give her a second to jump back on. But if there's any questions, please feel free to ask. Felisa, do you have anything additional that you wanted to add?
Yeah, I just wanted to say that I know my story didn't have a lot of new information or anything like that, but it's our story. And I think it's our stories that make a difference in the end. You know, there wasn't any new information. I'm sure many parents can relate to our situation. But it is alarming to me that, and you know, we've heard it all day today, how all these different systems and services that we need are affected by lack of providers. And so that's just, I think, you know, it all ties together. We're all connected, we're all related, and I don't want it to be all doom and gloom. And that's why I tried to paint a picture that we came up with solutions where we could, but in the end, we really, there is no going back to normal. And what we were doing before wasn't working anyway. So we should take this as a learning experience and move forward and problem solve together, staying hopeful and connected. Thank you.
Thank you so much, Felisa. You are amazing, amazing mom, amazing advocate. We appreciate your experience. We love hearing your stories. And we appreciate you taking the time to come and talk to us today about it. And I'll go ahead and move on. Since Pip's still not back, I'll go ahead and introduce our next speaker. So our next speaker is Cheryl Theis. Thank you so much. I am so bad with last names, and we really appreciate you being here, Cheryl, and I'll let you go ahead and take it away.
All right, thanks so much. So my job is to talk a little bit about the educational impact of COVID-19. And I always want to remind people that the laws that protect children with disabilities in school are, for example, the federal special education law. It's not the Individuals with Disabilities Academic Act, it's the Education Act. And education is a very broad term, including why do we send kids to school, social emotional well-being, how to work in groups, conflict resolution, how to meet deadlines, all of those kinds of things. And so what I would say is that across the board, there were challenges that continue to play out, and I want to point to some of them. First and foremost, we had so many kids who were not appropriately evaluated or evaluated at all. Many of the reviews just became records reviews where it was like, well, nothing's much changed. And yet kids were with parents who had a lot of information to share. In many cases, schools didn't really reach out to families about what was happening because everyone was assuming this was just a blip, a short-term problem. And therefore there was no need to gather data from families. And yet my experience is that all of us were becoming, special education teachers, general education teachers. We were helping our kids access occupational therapy, physical therapy online, which became ludicrous in many situations. And so, these evaluations that were created because the districts were really concerned that they didn't miss their deadlines for kids who needed an every 3-year evaluation. Many of those were just very generic and superficial assessments. And I also will say that, the U.S. Department of Education and the Office of Civil Rights said repeatedly, your obligation doesn't stop. You may have to do it differently, but you do need to provide these children with equal access and with services. For kids who needed special education for the first time, especially our babies coming out of here in California, our regional centers with developmental disabilities, but also so many kids who previously were in preschool settings where the Head Start teacher or daycare provider might have said, hey, I think there's something going on, a speech delay, there might be some other issues. Those kids didn't get referred, and there was no one to refer. And even when families asked for evaluation, the wait lists were enormous. And how do you evaluate a child who's not in the traditional school environment? So there are many, many challenges for schools, but the obligation remained. And so what's happening now today is that we have IEPs built on data that was gathered in this very superficial cookie cutter approach. And so we can't write a meaningful education program because everything in an IEP is based on the child's levels as determined in evaluation. For the new ones, the delays for early intervention are especially problematic. I mean, we know that, for example, every year that a child falls behind in reading, it takes about 3 years to catch them up. So, we created these huge disparities. For certain students, particularly we found many students with autism or similar kinds of issues where groups and social anxiety and sensory overwhelm were issues. There was a lot of regression in terms of coping skills. We had one parent call us and she said, before the pandemic hit, my child, got on the special education van, loved going to school. And now I can't get him in the car to go to the doctor. he's stuck in his room. And so, you know, it wasn't just a matter of returning to school. Oh, gee, now we're back in business. It was kids who could no longer access and had lost so many skills, coping skills, you know, tools and behavior support that they'd been provided. The schools really, and I totally get it, could not figure out how to use paraeducators. Many of them were laid off because how can you use a paraeducator? Even for kids who had a one-to-one aide, the parent was expected to be the one-to-one aide. There were impacts on parents' relationships with their kids. There were, now there is a horrible shortage of paraeducators because they left and went to other jobs. Many of them were laid off and weren't, you know, included in the planning or distance learning activities. And we now have this huge gap. Another problem that we're seeing in terms of the aftermath of COVID has to do with the students on the other end of the transition system, which we were just talking about. And that is that the transition plans. We had kids who were in a transition program in order to prepare for college, job training, independent living, and all of those things that are so important. But many of these plans included things like, you know, going out in the community, learning how to take a bus, learning all of those kinds of skills. And there was none of those services. And then many of those students aged out. And so they are no longer eligible for services, and yet they didn't get the services they needed. As a result, there's been a huge increase in the number of civil rights complaints filed. There's been a huge increase in the number of compliance complaints filed. But the problem, as always, is that the people who know they could file a complaint do, the people who can hire an attorney do. So many families have no idea, for example, that they could ask their district for something called compensatory education, even if the child is transitioned out of the school district because their services weren't provided. I think the collaboration between healthcare providers and schools has never been, you know, it's always been challenging. But as a result of COVID, I feel like there's been even more siloing than ever before. Many kids are still seeing their physicians, their therapists remotely. Telemedicine seems to be the order of the day. And things like observing the child at school, are not happening as frequently. And so I feel like we just have much poorer data about how to support a young person. And then finally, I couldn't stop, and I'm just going to pull up, I'm not going to share my screen, but I need to look at it to remember these statistics. So we've seen huge increases in the number of discipline referrals, especially for the little ones, elementary school, even preschool. We have more kids being referred for expulsion. It feels like last year was kind of a, oh, we'll be patient, we'll be flexible kind of a deal as schools reopen. But this year it feels like we're back in the same old business of, you know, excluding kids, suspending kids for behaviors, many of which are related to delays and lack of exposure during COVID. Preschool teachers are telling us kids have not their social skills, their self-regulation skills seem to be behind compared to their peers. And we've had, you know, huge increases in the number of requests for residential placements for students who have mental health needs. So kids who get so acutely destabilized that they can't go to school at all or need to be in a 24/7 kind of therapeutic milieu. And then reading scores dropped significantly, but most significantly for students with disabilities. They dropped almost 10 points between 2020 and 2022. Reading scores dropped significantly, again, almost 10 points for students with an identified disability. So, you know, there's a lot of work to do. And just to sort of leave us on a hopeful note, what I would say is that we need to get the word out. One of the things DREDF did, our organization did at the beginning of the pandemic, was we wrote a letter to the governor and we said, we want to make sure that as schools reopen, that there's a uniform process for figuring out what kids will need extra help or compensatory services. We didn't get that. And I think what we're seeing now is that a vast disparity between the families who are going to alternative dispute resolution or compensatory education meetings or hiring attorneys and getting services to help put kids back in the position they would have been in had they gotten these services. and the families who don't have those resources. And of course, all of these laws that we're talking about are built on the premise that every child has a parent who can advocate. And that's simply not true. We have parents who are not available, parents who don't speak English, parents who are dealing with significant other problems, kids in foster care. And that group, by the way, kids in foster care as adolescents, here in Alameda County, there was about a 50% non-attendance in distance learning rate. These are the most vulnerable kids in our state. And they were not even turning on the computer. They didn't have, especially kids in group homes. It was really challenging. And many of them just have not reappeared. We don't quite know where they are. So letting families know, working together to make sure that we spread the word that there's special funding for compensatory services. The schools have gotten money to do this. It's a right you have. And contacting your parent center. There's one in every single county. And I put earlier today the link for how to find us, because we can help you navigate that system and figure out how to ask for what your child needs and get them, hopefully the help they need to continue to learn and thrive. Thanks a lot.
Thank you so much, Cheryl. Really appreciate all your information. I think it's very important to get numbers out there. Sometimes we don't necessarily look at that, but I really appreciate you coming with such great information, and appreciate your time. You've been busy this morning, and we really appreciate that.
No problem.
Thank you so much. And the best for last. Hi, Tracey. I want to go ahead and introduce Tracey Tasker, and she will be sharing her PowerPoint. And I'll go ahead and give you your time, and just know that if you have any questions, of course, you can drop that in the Q&A, and we will try our best to answer them. If not, we can connect you with those that can help. So take it away, Tracey.
Okay, well, first of all, I wish I'd gone first, because it's really hard to follow Cheryl and Felisa here. Very insightful information and really heartfelt. First of all, I just want to add, I'm here talking about young children, and I'm going to try and go through this quickly because I have a lot of information to share. But most of all, I'm a parent. I have 2 sets of twins. Throughout their lifetime, I've gone to over 50 IFSP and IEP meetings as a parent. So I feel you, I see you, I hear you. My children also did not fare very well during COVID. They have special needs, and I'm going to talk a little bit about them as I go through it. But what I'm really here to talk about is what I noticed as an early intervention provider. So I'm a speech therapist in San Diego. I only do early intervention. And I started to see things that I'd never seen in the 12 years I've been practicing. Extreme stranger danger, fear, very delayed communication development. So this is what got me interested in this topic. So as Cheryl was talking about, just the numbers, and if you've been reading the news this year, you've seen this. Kids lost a third of a school year worldwide. Half the students started this school year in the United States behind at least one subject, often math and reading, which Cheryl talked about. COVID didn't cause the reading crisis in California, but it certainly didn't help. It exacerbated it, especially for our kids who are from disadvantaged backgrounds. Enrollment in preschools and kindergarten dropped. So you're seeing kids entering kindergarten who never went to preschool. So when we think about some of the issues that are happening now, what we're seeing in these, we're talking about preschool expulsions, kids didn't have that opportunity that they would normally have to socialize with other kids. So what happened with our youngest ones? Well, for our youngest kiddos, babies born during COVID, which are fondly called bunker babies because they had to hunker down, right? We're seeing global delays for many of these children. So delays in all the domains and significant delays. If you look at the quote that's here on the right, if we took this data and we extrapolated it to all the children born during COVID, what we should be seeing is a triple increase in referrals to intervention, early intervention. And I want you to keep that in mind because I'm going to refer to that at the end of this talk. So
very interesting research out of Brown University. And what this research looked at is what happens. Why are we seeing these delays? Well, one of the things that happens was a big decrease in turn taking between parents and children. And turn taking is what builds communication, your language skills. It also builds your brain. Not just between parents and their kids, but between child care providers and children. Significant decreases in that turn taking. And parallel research that was going on at the same time found something very interesting, that turn taking actually builds your social emotional skills, not the other way around. So we think of social skills, social children as taking more turns, but it's actually that turn taking that builds that social emotional strength. Also, I want you to remember that there's a key window in development, key window for language. It doesn't mean that children don't learn to communicate later on, but as far as talking, the 18 to 24 months is when we really start to see what we consider a vocabulary explosion. So as you can see in these graphs, kids are not catching up. And this is true for the school age kids. On that first slide that I shared, kids are behind, they're not catching up. This is true for infants and toddlers as well. You can see that they're still behind in 2022. Now I talked a little bit about brain development. What this chart is showing is that turn taking, not just parents talking to their kids, but the actual back and forth attempts at communication is what builds what's called the white matter in our brain. And white matter is what makes our brain more efficient. And what we're seeing is some concerning outcomes here is that white matter
didn't develop for many of these infants that were born. It didn't develop as quickly as it should. And that's what interested some of these researchers. They said kids were coming into these hospital clinics and they were really having a difficult time getting through this initial testing. So is this true for all children? One of the points that I want you to take away, and Cheryl kind of touched on this, is it's not true for all children. There's disproportionate effects on children. So some children actually had vocabulary and language increases. They had these moments with their parents where they could spend time doing things they wouldn't normally be doing. So if you look at this, children who had less screen exposure had bigger vocabulary gains. Children who spent more time reading books with their parents had bigger vocabulary gains. And I bring this up because California our literacy rates are terrible. We have the lowest literacy rate for adults in the country. We are the state with the lowest literacy rates. And as you saw, we have a literacy crisis for our younger children. And the statistics show that California parents are not reading to their children as much daily as other states. So what are some of the other things that could have affected child development? Well, social distancing. I was told by one of the companies that I work with during COVID, you need to stay 6 feet away from your clients. And I laughed. I said, have you ever worked with toddlers before? This is not how toddlers work. They want to be in your face, in your lap. They don't understand social distancing. However, preschoolers do understand social distancing. And their perception is that somebody who is close to me is a friend. Somebody who is far is not a friend. So this went against their perceptions of what should be happening. And what was happening, the research showed, is that when children tried to go to preschool, they didn't trust the staff. They had a hard time adjusting because of social distancing, that their perception was, this is not a friend, this is a foe. And if you think about communication, if you look at this pie chart, we think of ourselves as a verbal society, but we're actually not. Most of our communication is nonverbal. So this is really important. How about masks? Now, I am not an anti-masker, so please don't send me hate mail. You have my email at the beginning of this. I wore a mask all during COVID. I'm very concerned about the safety of my young kiddos, as well as myself and my own family. But facial recognition is a very important skill. And what I want you to think about is there's sensitive periods in development. And once that sensitive period passes, again, it doesn't mean that children can't learn, but it's going to be much harder. So young babies can only see a few inches away. So babies, when they were born, if they were in a hospital or they were in childcare where a face was covered, this was going to affect them. So children first learn to look at individual features on a face, but then they start to look at it as one whole unit. Well, you don't have a whole unit if half of your face is covered by a mask. Also, we were just talking a little bit about this social referencing. So if you think of children, when a stranger comes into a room or is approaching them, they look to their parents to see the parent's facial expression. Is this someone I should be afraid of, or is this someone that you like? That's very hard to do. I live in Southern California, and even outside, you're wearing sunglasses and a mask. There's no way to read somebody's facial expressions, right? Emotional recognition. Again, a subtle social smile can't be seen if you're wearing a mask. Now, as a speech therapist, I'm going to tell you 100%, the first thing I tell to my parents to do, hold things up by your mouth. Why do I do that? Because that is very important in language development. It actually predicts language development. Children who look at the mouth longer have better vocabularies. So there's a shift that takes place though. So children initially, when they are first, we just talked about this, they're looking at their parents' eyes. They can only see, a few inches away. And then they start to make a shift and start to pay more attention to the mouth. And by a year old, they're looking both at eyes and mouth because they've mastered their native language. This is not true for all children, though. Again, it's disproportionate effect. Bilingual infants, and if you look at the statistic, most children are living in households where there's another language spoken. They don't make that shift. They need to keep looking at the speaker's mouth, which they couldn't see if you're wearing an opaque mask. Autistic children. I have a son who's autistic, so this is one of the areas that I'm most interested in. They also do not make that shift. They tend to look longer at a mouth, not just for speech, but for emotional recognition. Now, who is really going to be affected the most by this are deaf and hard of hearing children. So what might be a very subtle difference in sound for you and I with typical hearing is going to be very significant if you're wearing just a regular, little blue and white mask versus an N95 mask. And you need that lip reading. Children need this, not even just children who are deaf and hard of hearing, but all children need this. So if I'm standing across a room from you, let's say we're at a party and I say to you, you could probably read my lips and know that I said time to go. Children don't have the context to fill that in. Their auditory structure in their brain is not developed fully until they're teenagers, actually. So one of the biggest impacts of COVID, and we heard a lot about this today from Felisa, was stress. Parents were stressed. I want everybody to put in the chat, if you feel that you experience more stress as a parent during COVID versus before COVID started. And I'm going to say I definitely felt more stress during COVID as a parent. So what's the problem with stress? What's the connection here to development? Well, the problem is that there's something called stress contagion where children can feel your stress and then they either internalize it and become anxious themselves, or they externalize it and we start to see these behavior problems that we're talking about. So as you can see, there was definitely problems, not just for the first few months of the pandemic, but extending well into the pandemic. How about families with autistic children? I have a 22-year-old son who's getting ready to graduate college. Unfortunately, he went into an isolated state during quarantines and became extremely depressed, and I had to pick him up and bring him home. And now he's completing college online. And that was devastating for him as well as for us. So this issue of isolation and loneliness and being stuck at home and unable to leave, this was a real problem, especially for families with autistic children. So if you look, there was also a lot of regression. And what really captured my interest here was this third bullet here, is that there was a lot of disruption of services, and telehealth was not the answer for everybody. And I can tell you, as someone who had to do telehealth for a year, for some families, it was marvelous, but not for all families, not for all kids. So if we broaden the scope, not just for autistic children, but for children with disabilities, we're going to see these same issues. We're going to see extreme stress, anxiety, depression, and then coincidentally, we're going to see these child behavior issues. And if you look at this bottom bullet, this one really captured my attention, this study, because it was 25,000 people. That's a huge research study. That's about as big as you're going to get. 82% of caregivers who had children with disabilities were affected psychologically by COVID. So what were some of the stressors? Well, interruptions in childcare. So families with a child with disability were disproportionately affected. I mean, this is a theme of most of this talk, is disproportionately affected. And what we see, what the research shows is that an interruption is not necessarily closing. An interruption is it's open, it's closed, it's open, it's closed. This is very detrimental for the social emotional development of young children. And we see these are the kids that you were seeing in pre-K now that are having behavior problems. Giving birth during COVID. I don't know if there's any new moms on the call, but I feel for you. I cannot even imagine how difficult that would be. Now, when we think about stress for new moms, what we see is this stress contagion again. So mom is stressed, and then she has a 3-month-old who also has trouble self-regulating. Now, stress and depression affect infant development differently. So what the research is showing is that moms who are depressed during COVID, they have babies who have poorer motor outcomes. Maybe babies spent a lot of time in containers, in swings, in car seats, in bouncy seats. There was a problem with bonding for moms who were depressed, difficulty bonding with their infants. For the moms who were anxious, it was actually a different outcome. These moms, it's almost like a protective mechanism like kicked in, an instinct, and they actually had better bonding experience, some of them. So what happens to the brains of infants when mom is extremely stressed? So we're talking clinical anxiety, clinical depression. Well, what the research found was when they tested these babies, when they did MRIs, there was different development, the connections between the part of your brain, your amygdala, that processes emotions, and the part of your brain, your prefrontal cortex, which is like the smart part of your brain, controls your executive functioning. These did not develop properly. And then if we look at previous research, these are the kids who are getting labeled with ADHD that are coming into preschool. These are the kids who are having behavior problems. So research that looked at brain development even before the babies are born. So our brain is developing very rapidly before we're 3 years old, right? So these babies, when they look at them, the hippocampus was affected. Now, your hippocampus is a very important part of your brain. It's a part of your brain that controls memory, but it also controls emotional memory. And it's very connected to the part of your brain that tells your HPA axis, which controls your stress hormones, to stop releasing those hormones. So this is really detrimental for the children who had this brain structure development, because then again, what we're going to see and what we saw with these children was that their social emotional skills are delayed, but also their cognitive skills are delayed. And as you could see, parents weren't just stressed at the beginning, they were stressed 18 months later. Now, as I mentioned, I have kids who have special needs. I had babies that were born at 29 weeks. This is a picture of my daughter, Sophie, when she was born. She's now 18. And so I have a special place in my heart for my NICU moms because it's very stressful to be in the NICU in general. Now, moms who can, and this is in California, moms who got COVID, they had a 40% increase in preterm births and 60% in very preterm. So I want you to look at the next picture. This is, again, a picture of my family. This is my husband with me and my 2 older twins. That's my son, Luke, looking at the camera. And this is not the experience that other moms had. So I had the luxury of having my husband there, of my other children being able to start to bond with their baby sisters before they came home. This was not the experience of most parents in the NICU. Only one parent was allowed in at a time. There was limitations on how much time, a lot of isolation. And as you can see, nobody here was wearing a mask. How about preschoolers? I want everyone to put in the chat, did you feel like your household went into chaos during COVID? I know my household went into chaos with everybody coming home. I had my son bringing home a friend who couldn't get back home to South Korea, and all of this stuff was just crowded and noisy and chaotic and stressful. So preschoolers are very sensitive to chaos, and chaos includes crowding, noise, it could be the neighborhood that you live in. And we saw a lot of people got lost their jobs, lost their housing, had to move in with families. So this was very common. And if you look at the statistics for California, it's almost twice the rate of crowding compared to the rest of the country. So families that were able to maintain some sense of normalcy, some routine, their children had less responses to stress. Now, the problem is, for other chaotic environments, this can affect your language development, affect your behavior, possibly, again, we're talking about kids who are going to get ADHD symptoms appear once they're preschool age. So one of the biggest pieces of, consistent research that came out, replicated research, was a new normal, less physical activity, and Felisa talked about this, less physical activity, more screen time. This affected kids' sleep, especially infants and preschoolers. So what's the problem with screen time for very young children? So I'm talking infants and toddlers. The problem is when children are infants, they need to learn to self-soothe. And the more that you give an infant a device to soothe them, the less likely that's going to work. And this is true for preschoolers as well. It sends a dopamine boost to their brain, and they don't know how to self-soothe. So how much screen time was going on during COVID? Well, if you look at this, children who spent more than 4 hours a day using devices. Now, the first bar is 0 to 4-year-olds. So it doubled during COVID. So children under 4 spending 4 or more hours on devices. Now, why? And I've spoken to parents before, and parents still had to work, and they did not have childcare. So as they lost their childcare, there was a direct correlation with screen time going up. Unfortunately, screen time for young children is not necessarily educational. Now, a lot of families that I work with tell me, oh, my kid learned to talk through YouTube. 5% of YouTube content is considered highly educational. So as we talked about before, preschoolers, the parents felt that they just could not expect their kids to stay in front of a screen. So they put on YouTube for them. I'm going to end by just very briefly talking about screening. So a lot of kids missed their well visits. A lot of kids missed their screening during COVID. And some of the families that I work with, they didn't necessarily have any other children to compare their kids to. So they didn't know quite how delayed their kids were because they never left the house. Some families, I had kids who just started going to the grocery store for the first time. They'd never been any place but their house and grandma's house. So we're not necessarily seeing that 3 times referral to early intervention that we talked about at the beginning. Another thing that I want you to know about, because I don't know how much doctors really explain this, the CDC changed their milestones during COVID, 2022, early 2022. Not because of COVID, it was 20 years since they had done this. But it's important to understand that there is a difference now. So what they did was they changed it from the average of when kids should meet a milestone to when most children. So what happened was most of the milestones got moved to an older age. My concern about this is some of these milestones you really want to be asking about before kids are 30 months old. 30 months old, we're already having a transition meeting with the public preschool. So we want to be really trying to catch these kids earlier than that. So I'm going to end on that.
Thank you so much, Tracey. We really appreciate all this information. It's such a great PowerPoint. I really can't wait to get a copy of that and share with staff and share with our parents. I think it's really fantastic information that we don't necessarily think about. We're trying to, as Felisa said, go into this new normal, which we're going to continue to run from, but are we really gonna ever go back to normal? Probably not. So I'm very grateful for all the information and putting this together to help us with this visual that's gonna really assist in trying to explain why things have happened the way that they have happened. And of course, if anybody has any questions, feel free to drop those in the Q&A or in the chat. Send some love to our presenters. They did such a magnificent job. I really appreciate it. And if anybody else has anything else to add, please. go ahead, the stage is yours.
I have one more thing I'd like to say, if that's okay, which is that I think that we minimize the importance of ongoing stable relationships for all kids. And I think the teacher shortages, the para shortages, the shortages of occupational therapists and speech therapists, I think the educational system, but also healthcare system, everybody's still reeling and trying to kind of build back to where they were before. And so many people left nursing, medicine, teaching. So, we really do have children, for example, with autism, who, sort of notoriously are difficult transitioners. I mean, it's one of the hallmarks of what makes, what's a challenge for a child with autism. It's not true for everybody, but often true. And those kids, they finally get to develop a relationship with the teacher. There's trust, you're starting, and that's required before you do anything else for most kids. And then it gets disrupted. We have kids literally, like, short-term subs are only allowed to work for a month without a special education credential or a teaching credential. So every 30 days or so, the schools are having to bring in another sub. And so that impact is, it just compounds the problem over and over again, because our kids are losing these important connections. I mean, children love their teachers in many cases. It's an important relationship, often your first one, away from your parents. So, and I wanted to say too, Tracey, you probably saw me nodding my head, but I couldn't agree with you more about the families for whom it was their first child. Because I have a daughter who's a family medicine physician, and she said that, kids are coming in and they're 3 and they're not talking, and the parents like, oh, they're a late bloomer. And so we just missed so many kids. So I'll stop there. I just wanted to make sure I added that.
Yeah, that's a really important point. That I'm glad you brought that up, because we've been having that challenge a lot with, I think Lily's had 3 since COVID, or since she went back to school in 2021. I think she's had 3 different ABA therapists now, and they only worked for 2 or 3 months at a time. And that relationship is established. And then to her, it's a friendship. It's like, where did my friend go? And why did they not say goodbye? And, so those things, they affect that mental health piece of it too. And I think that that's part of some of the struggles we're going through right now. She used to love to go out, love to go do things. And now I can't get her to go down the sidewalk, and if we're not going for a ride in the car, then she doesn't want to go. So, and she's an adult. I have to honor how she feels, it's not that I'm going to just pick her up and throw her in her car seat. Right. So there's lots of moving parts to that experience, and families are really not doing as well as we might think they are.
I want to apologize for technology taking me away. I took off, had lunch, dessert, and came back. I'm stepping in here at a disadvantage, so please be patient. I got to see some of your slides and presentations and talk with you prior to this session. And I'm just wondering, while I was out talking to our internet provider, were there some suggestions? Cheryl, I know we're working a lot with resolution. How do we really pick up and move forward at this point? Recognizing social emotional health, but also physical health, and what's been suffering through that. Were there any thoughts, or maybe you all figured it all out while I was gone?
Oh, no. No, I mean, I think, again, I'll just speak on the education side of the house. I see so many families who have kids in more restrictive settings than they were before the pandemic. I think it's important to remember our kids lost often their least restrictive environment, because we often did push in, like, the speech and OT, what we could do. I mean, again, the schools were in impossible situation, but maybe not that experience of being in a classroom. So the good news is, and I think you're right, it's important to end with a little bit of good news, is that, you know, the states did, and the federal government did give districts some money to provide for compensatory services. I think it's been uneven in terms of how it's implemented, and people don't even know it exists, but it is there. And in California, we've moved toward more alternative dispute resolution. And I just, you know, it's a big part of the parent center movement in general. We want to solve problems at the local level. We want to maintain our relationships with the people who are teaching our kids, you know, with our local community. And so if you can avoid something escalating, I think was it you, Felisa, who said you had to get an attorney involved, and then things got better. We want to avoid things from escalating. So alternative dispute resolution can be as simple as, you know, you go to an IEP meeting, you're trying to bring up all these issues about what's going on for your child post-COVID, and that these are linked to you know, some of the difficulties of the pandemic. And you can, instead of sort of having to file a formal complaint, you know, go to the special education director if you didn't get a good outcome in the IEP meeting, and say, you know, or to your special education local plan area, which is sort of the umbrella organization over districts here in California, and say, you know, look, can we just talk? Can we figure out, you know, maybe we could fund a, you know, social skills camp for this child this one time, not regular extended school year, but maybe just this year, because they lost so much benefit from not getting those services in a meaningful way. And so, you know, there are options. And if people have questions about that, feel free to reach out to me. My information is available through Family Voices. And, you know, if I'm not the one to help you, I can refer you. But I think that's one, I don't know if it's a silver lining, but it's a little bit of a, you know, a good thing that's happened is, you know, we want to solve problems. And I think that special educators, you know, they don't go into this business because they don't want to do the right thing, but boy, they're so constrained by so many barriers. But this is one way to get around it.
Thank you for that. Yeah, having those discussions, you know, and with the expansion of family empowerment centers, you know, we were all looking towards our PTIs, but now local family resource centers, family empowerment centers are working a lot more closely with their school partners on conflict partnership is something that I like to say, because there will be conflict. There was a question or a mention in the chat, and this really looks back at that early childhood experience from a parent, you know, mentioning that her children are now entering school, you know, without having that preschool early education experience. Can you speak to the expansion around TK, but also maybe some ideas of what families could be doing, because they need one more thing to do at home, just to promote that school readiness. There's so many initiatives focusing on that, but maybe a few words on that as well.
So I'm just going to speak from a speech and language perspective, but also social emotional. One of the things that I did with some folks from the ARC was we started a social skills group, and it's for toddlers, because we had these toddlers who'd never been out of their house. I mean, really had not been any place. And what was happening was these kids were going to story time at the library and then being asked to leave by the librarian or other parents, and mom shaming was going on, which is horrible. So we said, all right, this is what we're going to do. So I think some thinking out of the box, because I'm just going to be, well, first let me ask, is anybody from the regional center on this? Because if you are, speak up now, because I'm from New Jersey and I'm very direct, so I'm just going to say it. The regional center really needs to think out of the box. They told me toddlers don't need social skills. And I'm like, really? Because that's when social skills develop. They really do. Nope. No under 3 social skills group. So there is a social recreation grant that is being developed right now. And the regional centers really, this is part of their mission, is to provide social recreation. So for the mom in the chat with the 4 and the 6-year-old, look into social recreation groups, because these kids need to have that experience with other kids. The only way that they're going to improve social emotional skills is with other kids. This is not something that you develop through ABA. This is not something that you develop with adults. You only develop it by practicing with other kids. And I say this as a parent of an autistic child. His social skills did not develop. He never had ABA, for one thing. They did not develop from that. They developed from practice, okay? So push your regional center for social recreation. I would also say that learning is cumulative. So, you know, if kids are already behind, and you talked about this with reading, Cheryl, if they're behind in language, guess what? They're probably going to have trouble learning to read. So whatever you can do to boost those skills before they actually have to learn how to read to your kids. And take turns with your kids. I think some parents think that language is, I just have to bombard my kids with words, but it's not. It's that dance, that communication dance. And your child, when I say communication, doesn't mean that they're speaking back to you. Communication could be a smile, a head nod, a high five. It doesn't have to be verbal.
All those key points. Given we've got a room of expertise here, and that includes the participants that aren't on this panel too, there's been discussion around thinking out of the box. What resonated with me, and just when I was able to come back and hear the conversation, was just around parent initiative. You know, we like I said, we don't want to be asking, you know, or saying one more thing for you to do. But as we have learned by from Judy Heumann and all of those parent and individuals and disability rights leaders ahead of us, it's what every little thing that we can do to promote change. And I'm just looking at now children entering school, having missed out on some of that early socialization and development. And then I think about students like Lily who are leaving into the adult service system, where there is a shortage of providers across the board, from early intervention all the way through adult services. I always thought schools, and here in California, our regional center partners and other disability advocacy groups, we've got to be working together on what life after school looks like, because right now it's very bleak, and the impact on quality of life. I think we've got to be paying attention to that. If you had your magic wand and could say, hey, you all need to be working together and we have to have this common goal, what might you do with that magic wand to better prepare for that, to support that quality of life after school?
I have some thoughts on that, Patty. You know, one thing I mentioned is the challenge right now is there's not a day program, which is what I always envisioned that would happen for Lily, right? So we're in this situation now where we're sort of trying to design a day with self-determination. And one of the things is they give, you know, as an alternative right now, I have a pool of hours, right? And I've got to go find a provider that will spend the day with Lily, and we're making progress, and I'm excited about that. But we have this big pool of hours, right, that I can't fill because I don't have enough people or enough shifts to cover that. And one of the challenges that I've had in doing that is I can't pay them enough because I'm not in a position to supplement the pay that's offered through the regional center. So what if we reduce the number of hours and increase the amount of pay? I mean, that would take a huge burden. At least we would be getting something, you know, we would be getting some hours met, you know. These are just the little things that occur to me, but yet, you know, I think on some level, they feel like they're helping because they've given me all these hours, right? But I'd rather have less hours and an actual person that wants to be here working with my daughter, giving her the life that she wants to lead, you know, helping her with her communication support, taking her to the places that she wants to spend her time, and giving her the companionship and friendship that she needs. If I could get that for 10 hours a week opposed to 25, that would be something, and it would be much more meaningful. So kind of, you know, just thinking about, you know, what are the things we need, and then getting people to actually listen to that and then move to action to make it happen.
Sounds like you're taking those lessons. I know Felisa, the project leadership graduate, she's taking those lessons from individual advocacy for your own young adult towards system advocacy there. Tracey, Cheryl, you have some thoughts about that?
I think advocating is a good word here. So we do need more providers, but the regional center is in denial. They told me they're meeting the need, which is just not true. We have a group of highly qualified and educated students graduating from local speech language programs, but the regional center has a rule that they won't let them do early intervention home visits. And there is no rhyme or reason for this rule. They have a master's degree. They've done externships, but someone in Early Start just made this rule and they refused to change it. So I think the problem is we don't have we don't have a voice. The regional center makes their own rules, and each regional center does things differently, and we don't have enough of a voice to make a change. So I think it's getting that voice with the regional center is a problem.
Patty, you brought that up to me not too long ago about getting involved with the regional centers board, and that's going to be something that I'm going to do. But I'm also going to actually, you know, not just think about the things that I need. I'm going to actually say the things I need, my service coordinator. And I think it takes a lot of parents saying what they need, and then that collectively being heard, you know, on a bigger level for that to happen. So I hear what Tracey's saying too, though, because I have run into, since we've been in a situation where we're trying to design and self-determination, there's been lots of little roadblocks. I mentioned that in my presentation, that it's taking a long time. I mean, we're almost, December 16th was like 3 months ago now, right? And we still have, 3 hours a week of coverage. So, you know, have a long road to pave. Yeah. But you know, where it's going to take some time, and it's going to take some action. And, you know, we're going one day at a time to preserve what we've been talking about all day. And that is our mental health and our resources within our own environment. So, but I also mentioned in my presentation that it's important to stay hopeful, and that part's really important to me. So I try not to get too hung up on the things I can't do and focus on the things I can do. And that's been helpful for us.
Yeah, one of our biggest advocacy tips for families when they're getting stuck, you know, when the schools are meeting on the same issues over and over again and nothing's changed. We've all been there, right? Is that you always want to advocate for something, not just against what isn't working. And unfortunately, or fortunately, depends on how you look at it. Sometimes it's you who has to think of the solution. And I think that's where getting involved with things like your community advisory committee for special education, your regional center boards, going to school board meetings, raising these issues so that other people in the community know about them is important. For example, one family that I know of, and they had the advantage of having the mom was an occupational therapist, but they had a child who was really struggling and supposedly had inclusion time, but really wasn't happening even before COVID hit. And the child, because the child had multiple developmental and medical needs, the assumption was, I think, really that you couldn't expect much. I mean, I really felt like that was a big part of the school's thinking about this, is that she didn't seem to be responding to many interventions. Well, when she was home during COVID, her parents decided to work on the reading issue, because that seemed, for a child who was nonverbal, to have those skills seemed so important. And the child who had an IEP goal that said, she'll learn, 10 words on her AAC device, the mom was able to videotape the words big and blown up, at the 100 words she learned in a month. And so the school was pretty shocked, but, it turned out that there had been this huge underestimation of her abilities, because so much of the testing we do is verbal, right? And we tend to judge intelligence by oral speech a lot. I'm sure, Tracey, you see that. I mean, and so, but these, I love these parents because they didn't leave it there and just say, shame on you. They said, this is what we did. This is what we found out worked, and so just documenting all of that into a parent report. And they said, you're all experts in your fields, and we're an expert on our child. And so I think, thinking about possible solutions, and as a caregiver, whether you're a grandma, a kinship provider, a foster parent, a biological parent, if you have, that child so well, that young person so well, and getting that information to the team and making suggestions. Have you thought about this? Have you thought about that? One final quick example is I had a father who came in who was really discouraged about his child's progress, and the district was proposing to limit services because she wasn't making progress. And as we talked, I said, oh, can I see a picture of your little one? And, she was nonverbal, and she had a lot of, I think she was a wheelchair user, and there's a lot of stuff going on for her. But to read the descriptions of her in the reports, it sounded almost like she was in a vegetative state or something. I mean, it really sounded like she didn't have much going on. And he showed me, he said, oh, I'll show you a video. That's why I love, my iPhone. And it was a video. He was a musician, and it was a video of him drumming with her in his lap. She was completely lit up and alive, and just, and I said, I bet the school has never met her. Right? They don't know her. They've never met her. And so we ended up advocating for helping them advocate to get music therapy into her program. And it was enormously helpful. And it was helpful for all the kids in the classroom too. That's the other thing to think about is, I think what you said, Tracey, is so true. We want kids to learn skills, but you could teach somebody till the cows come home, but if they can't generalize that skill in a real life environment, that's useless. And that's the value of universal design for learning and inclusion and all of that too. So I just encourage you, if you know something works with your child, share it. If you have a solution, why not propose it? Instead of just saying what you're doing isn't working, here's something I know that might work.
And I think, go ahead, please, Tracey.
I think that's a great point. It's actually something I did for my son. I always made this little Meet Luke letter, and I gave it to every teacher, every person he was going to come in contact with. And I encouraged my early intervention parents and, the parents here in the chat who said that her child's going to be starting without having gone to preschool, is going to be starting kindergarten. Make a letter and talk about your child's strengths, because schools also like to be very deficit focused and underestimate kids. So talk about your child's strengths. What motivates them? Give the teachers that information. And video is great. I've gone to many an IEP meeting with my families when they made that transition to preschool, and had everybody watch it, everybody on that team. when they were saying, well, she can't do this, she can't do that, she can't do this, because just because you haven't seen it in the classroom doesn't mean that that child can't do it. So videotape your kids and play it for the school.
And I'm putting in the chat a great resource about how to write a good parent letter.
Great, thank you. We used to call them the one-page profiles or the one-page fact sheets, and I've seen them used in early intervention, you know, and when the children are transitioning to preschool or maybe childcare, other early education systems. But where I also saw them having the most impact were when the students were transitioning to junior high and high school. Mm-hmm. And that's when we saw some self-advocates really blooming. And I know one personally, my granddaughter, she just had about a stack of at least 10 copies of her accommodations, her strengths, her needs, what she absolutely did not like. And she would hand it to that teacher, she would hand it to the substitute, and she would hand it to everybody she needed to. So there was a lot of growth with that.
Yeah, I see a comment in the chat from someone who says that during distance learning, their child, you know, the staff really got to know their child better because, you know, and I think some families did have that experience. And I think the benefit of using technology can't be underestimated. So I've told parents, like, they'll say, well, I don't know how to build a transition for my child. You know, he struggles to communicate and he's, you know, has pretty significant developmental disabilities. And I say, you know, one of the most important things in a transition plan is like, how do people work effectively with your child or young adult? And so videotape what it looks like when he's in his good zone, what it looks like when he's calm and relaxed. Describe, you know, how does he indicate distress? You know, if you want to think about quality of life issues, using a video or pictures with hopefully without being overly invasive, can be really helpful for people, because I think that, you know, when you're meeting someone for the first time and they're in a really stressful environment, including post-COVID with all the things we've talked about today, you may not be meeting that child or that young person. So, you know, as parents, that is the magic sauce we have. If we can get past our own stress, frustration, overwhelm, because I really want to say, Tracey, I was, and for you too, Felisa, like I just, I had at the time a high school freshman, my youngest, and it was not for the faint of heart, parenting a kid during COVID and trying to be a teacher and working full time and talking to people every day who are having terrible experiences. You know, compassion fatigue and all of that is really big. And so I just want to also validate that this is really hard work. I tell people when I'm teaching or training sometimes, you know, welcome to special education. You have a new part or full-time job, because that's really how it feels.
I'm going to help us wrap up here. And I can't help but go back to what Elena Holmes mentioned yesterday, and it was own your power. And since family voices, you know, this whole thing is preparing us to move forward, but also down the road, there will be a legislative day. And I would very much love to have the participants maybe toss in the chat, you know, if they were going to see their legislative representative tomorrow, what is the message that we would want to take forward with that? And I know this usually takes a lot of thought, but you know, it's kind of like that magic wand again. I wish this. Well, it can happen with the combined voices, and it might take a while, but we can get there. So with closing, I would really like to invite members of the session to please put in chat what maybe you would like to say as we move forward with this, or maybe what we would like to be telling our legislative representatives as a group. And with that, I would also just like to ask Cheryl, Tracey, and Felisa to please maybe add your closing thoughts before we move on to our 1 o'clock closing session. Put you on the spot there, huh? I'm the one that bailed on you for a half hour.
I think Felisa said it very nicely that, you know, if you think about it timing wise, we're going into that week, right? When everything shut down. We're entering the 3-year anniversary of when COVID really started next week, right? But it's not over. You know, people want to go back to business as usual. It is not over for many families and kids.
Yeah, and I would add to that, you know, I have a sister who's a child welfare worker on the hotline. And, you know, she's been talking a lot about the increase in calls, the kids who, you know, there's just so many issues and a snowballing effect. But I also totally agree with what you said, Felisa, which is there is hope. I see kids who, when they get the right services, it can take stopping and starting it, you know, but when you see it coming together, it's so awesome. And we lose so much if we don't find a way to let our kids shine and see, and, you know, have the lives that they deserve and that we deserve. And, you know, I often say, you know, pay now or pay later when I'm talking to special education directors, because, you know, you don't address a mental health issue, you can end up with a residential placement of $80,000 a year. Like, let's get in front of it. And so, you know, I hope that people will keep using those advocacy skills. I think we're all trying to recover. I think, you know, battle fatigue is a little bit of an issue for a lot of us right now. And get involved, again, whether it's with the regional center, your school board, your community advisory committees, and keep letting people know what's happening, because I think there's a lot of people who just want to try to get back to business as normal. And I don't think, as I think someone, I know you said that we're not going back, you know, we're still telecommuting a lot. Look at us today. We're all on Zoom. And, you know, we need to sort of acknowledge the reality of our situation so that we can improve it.
Well, I was going to say all of that. And I'll just say a couple more things. I especially like the point that you just made about us being on Zoom today. It gives us the opportunity, I think someone mentioned earlier this morning, to involve more people, or maybe it was you, Patty, yesterday in your opening. Being on Zoom and being able to do things virtually has opened up, I mean, there's some good things that came from the COVID experience too. It's revealed a lot. And I think that it's important that we take those learnings, put them into action, keep thinking about the things that we need, keep speaking up about the things that we need, and expect people to listen. That's, you know, but also be mindful of where you are and take care of yourself. Take care of yourself each day. Take it one day at a time, but always be taking one step forward at the same time.
Well, on that note, thank you for the comments in the chat. That's given us some direction as well. Tracey, Cheryl, and Felisa, I would very much appreciate your participation, your words, your vision, sharing your personal experience as well. So thank you all very much, and I'll see you in our next closing session. Thank you.
Thank you.
Thanks, Patty.
Thank you, Martha, for covering.
I was like, where'd Patty go? Where's Patty?
we had a total outage here.